Welcome to the Collaborative Care Series. My name is Zubin Austin, and I am from the University of Toronto. In the Collaborative Care Series, we are following Jeff Cardew, a big city pharmacist who has moved to a small town and is establishing his practice and his professional role. In this module, we will examine the issue of fee for cognitive services. Many pharmacists express concern about the viability of a practice model that involves direct patient care. In this module, we will see Jeff establish a relationship with a patient and start to discuss complex issues related to fee for service in an effort to establish an economically viable, patient-centered pharmacy practice.
Hey, what's with the sign? You bringing in a guest speaker or something?
No, just me.
You. I mean, right. Cool. What for?
Well, we've had quite a few diabetes patients come in, and based on some of the meter reports I've seen, some of them are nowhere near their blood sugars need to be. Plus, I was looking at your prescription sales report and noticed just how many diabetes meds and supplies the store goes through. I mean, we almost ran out of test strips this weekend since I started getting so many patients to use them.
Yeah, I saw that.
Mm-hmm.
So you do this?
What, run clinics? Yeah, sure.
Because, I mean, we never had that before. Are you sure it's okay? Who's going to cover?
Avery's coming in.
Really?
Yeah, so I don't get pulled away from the consult room, in case a prescription needs filling.
What's this?
That's the sign-in sheet. Do you want to be first? Okay, Mr. McGinn, this should do it. 60 days of your glycoside taken twice daily before food, right there in the bag for you. And this.
Clinic, huh? This new?
That's right. Just starting up this week. Actually, you would be an ideal candidate, Mr. McGinn.
Really? Why is that?
Well,
I mean, no offense, but what can I get from a clinic that I'm already not getting from my doctor?
Well, these are guaranteed one-on-one sessions for a half an hour, and it's a great opportunity for patients with diabetes to get their questions answered around their medications, their concerns, complications, any other concerns, really. Are you interested?
My doctor is great. He is. And I'm usually in and out of there. I have a busy schedule.
Mm-hmm.
But now that you mention it, there have been a couple of times when I meant to ask him something and then forgot and then remembered after the appointment.
Yeah, it happens to a lot of us.
Or, the waiting room was full and you really didn't have time to answer my questions.
Okay. Well, I've got a lot of openings this week, and we could do it, early in the morning before the workday, if that helps you out at all.
Whoa, wait a second. You're charging for this? $50?
That's right.
Oh, okay. Well, now I'm really confused. I mean, why the heck should I pay for a service that technically I could get for free if I just remembered to ask my doctor?
I realize that this is something new, and it might take some time for some patients and some healthcare professionals to get used to it. But the clinics are, meant to offer you something that goes above and beyond the counseling that Avery and I do, and more than your family doctor does. In this case, I've been trained as a certified diabetic educator.
Yeah, so?
Another way to think about it is as a full medication consulting service.
How so?
Well, the clinics go beyond the usual scope of what pharmacists do. We have a skill set and a knowledge base, and these clinics allow us to provide a much-needed service to the community. Much like you would pay for other services. A contractor for your house, say, or legal or accounting services. These consultants provide you with specialized information about a component of your life. What would be more important than your health?
Well, I see your point from a business point of view. If you're going to take time out of your day to provide an essential service and then not get paid for that time, well, that's just not a good business practice. But still, don't I pay you guys already for that time? Plus, I pay you a dispensing fee, right?
Yes. But the benefit of the one-on-one consult is that we may uncover issues that need attention, issues that wouldn't normally come up when you're just coming in filling a prescription. This is your time, uninterrupted. What we would do in your case is that we do a full medication review of your current diabetes regimen, and we would have time to explore any other health concerns that you might have.
All right. I'm sold. Sign me up.
Excellent. So I do have some openings tomorrow morning, in fact. Is 8 a.m. too early for you?
Ha, hardly. 8 a.m. it is. See you then.
Great. As I said, Mr. McGinn, you're doing everything right. You're taking your medication perfectly, and looking at your logbook, your numbers are fantastic.
Well, I'm trying to stay on top of it.
Well, congratulations for all of that. Now, did you have any other questions about your medication specifically, or any other concerns at all?
Not that I can think of. Should I?
Well, you've got your blood sugar levels under control. That's good. However,
Yes.
well, looking at the whole picture, did you know that over 75% of deaths in people with diabetes are related to heart problems or stroke?
What, like heart attack? Well, I have a high stress, high pressure job.
Well, high blood pressure is one of the leading causes of heart attacks or strokes. So that's why it's just as important to get your BP under control as it is your blood sugar. Now, your BP is currently at 135/87. That's normal, but above target for someone with diabetes.
What do you recommend?
Well, to help you stay on top of your blood pressure, I recommend an automatic blood pressure machine.
What, like a home unit?
Yeah, they're extremely affordable. There's one in the pharmacy here, and I could show you how it works.
Bit of an information junkie. I'll look this up at home online.
By all means. Now, that leads me to one more thing.
Oh, there's more?
Yeah, I would like to recommend just another OTC, over-the-counter medication, just a low dose of aspirin. And with your permission, I'll fax these recommendations over to Dr. Poole just to keep him in the loop.
To think. It's all started as a diabetes clinic. Thanks a lot. I appreciate it.
Yeah, no problem at all.
Say, you don't just run diabetes clinics, do you?
No, I mean, it is my area of specialty, but there are many other clinics that I can provide. What were you looking for specifically?
Here's the thing. I run a small business. And for obvious reasons, I want to make sure my staff stays healthy, right? We're not a big shop, so every person is vital to the organization.
Yeah, I understand.
Well, see, between you and me, half my staff still smokes, which drives me nuts, but I can't say anything about it because I used to smoke myself.
Well, I can certainly provide a smoking cessation clinic.
That's what I'm talking about. I mean, of course I care about my staff.
Of course.
But if I can provide a stop smoking program to my employees through healthcare benefits, hey, my staff will be happy and just maybe my premiums won't go through the roof.
Great. Well, I'll see what I can do.
Thanks a lot for the clinic. I'll be back.
Excellent.
Tell me a little bit more about this clinic.
Mr. Cardew, I received the recommendations for Doug McGinn. Thanks for that.
My pleasure.
Yeah, Doug is coming in early next week for a follow-up, and I'll check his BP.
Great.
So, tell me about this clinic. Avery says it was a success.
Oh, that's good to hear. In fact, it's still going on. I plan to keep running it.
Oh, good. Why don't you send me the dates? I got a few more patients that keep me banging my head up against the wall. I just can't seem to get through to them the importance of good control.
Right, of course.
Now, how do you market these things? You'll have to excuse me for playing the old age card, but, back in my days, it was pretty much word of mouth only.
Well, that's still a good one. I've got some in-store promotional items, bag stuffers, flyers. Tell you what, Dr. Poole, why don't I send some flyers to your office, and that way you'll have some for your patients.
Excellent idea. Yeah, why don't you do that?
Great. Now, while I have you on the line, can I check in with you about something else?
As we have just seen, patients who perceive value to the work pharmacists do may be willing to pay for it. The issue of reasonable compensation for the cognitive work that pharmacists perform in providing direct patient care is an important issue that is currently under discussion. To join this discussion, click on the discussion link and share your thoughts, ideas, and innovations with other pharmacists.